Is it a corn or is it a wart? I've got to say, we're really good at knowing the difference, and some other health professionals aren't so good at knowing the difference. I'm Alison, one of the podiatrists at the Foot Centre, and I would like to explain the difference to you. So a wart is a virus, and when they're on the bottom of your foot, it's called a plantar wart because that's the plantar surface of your foot. It's no different to any other wart. It's a virus. And a corn is a reaction to abnormal pressure. So sometimes they can be on the bottom of your foot from the way that you're walking. Sometimes they can be on the tips of your toes or on the outside of your toes if your footwear's inappropriate. So a really easy way to differentiate between a corn and a wart is a corn will usually hurt when you press directly on it, and a wart will hurt when you press from the sides. Had an interesting patient yesterday who had been to another health practitioner, and they had started cutting away at the area and said, if it bleeds, it's a wart, if it doesn't, it's a corn. That's not correct, unfortunately. So with a wart, you also see a disruption of the striation lines. So your striation lines are the fingerprint lines. So if you had your fingerprint taken. So when you've got a wart, they stop either side of the wart. And we will often use a dermatoscope so we can zoom in and have a look at the striation lines and also the integrity of the tissue. We're pretty good at guessing without the dermatoscope, but the treatment is very, very different as well. So with a corn, it would be about removing the cause of the problem, and with a wart, it's all about trying to trigger an immune response so that your immune system will kill off the virus. Both of these conditions can be very painful as well, and yesterday the patient who had been told it was a corn when it was actually a wart was also getting pain in their knee and their hip because they were walking differently to try and keep the pressure off the area. So there's lots of things we can do around that as well. So we're exceptionally good at differentiating, and it's really important to get the diagnosis correct, as I harp on about time and time again, because if you haven't got the correct diagnosis, you can't come up with a treatment plan. So there's the hot tip. If it's a corn, it usually hurts to press this way. If it's a wart, it normally hurts to press that way.